Which treatment would remove my dark circles? Mine are bad and hereditary. My mom has them almost as bad as me. I get enough sleep and eat a lot too. No alcohol, no smoking.
Thank you for your question. You've submitted a single photo with a concern about dark circles under your eyes. And fortunately, you don't have any of the other confounding factors, such as smoking, that can certainly make these things worse. You describe a situation where basically this is a genetic trait. Now, I could tell you that there is certainly a lot to the genetics of dark circles that limit our options and what we can do. When a certain ethnic group, and anyone with like a darker than Mediterranean skin or even the Mediterranean skin type, very often it is common to have dark circles under the eyes. When I look at a patient with this concern, I break down the elements that contribute to the quote dark circles that can be addressed, as well as what level that they contribute to the overall appearance of the eyes. So when we look at the lower eyelids, we look at the pigmentation of the skin, we look at the skin quality, we look at the areas of relative hollowing. In particular, we pay attention to an area called the tear trough. The tear trough area is just at that area where the edge of the eyelid meets the kind of the cheek area. It's a very common term used these days. And I look at the under eye area for puffiness or under eye bags. And then I look at the area adjacent to the eyelid-to-cheek, we call it the eyelid-to-cheek junction, to look at the orbital rim or the bone under the eye and the cheek volume. So you can see that there are many levels to the treatment of under eye dark circles that can be approached and addressed. Many years ago, and I've been in practice performing cosmetic oculofacial plastic surgery for over 20 years, I can tell you that there were very few options and we would basically just throw up our hands. But fortunately, these days we have some options. And I'll share with you how I approach a situations like yours in my practice. So when we look at the hollowing component of the under eye dark circles, hollowing usually means some type of volume enhancement. We're fortunate to have a lot of fillers, such as those in the hyaluronic acid family, examples such as Restylane. Now, Restylane can be placed very strategically in the tear trough area. This is an art, and that it is not done exactly the same between doctors. So there's an art to filling that space to help soften the depth and darkness and shadow created by relative hollow. In addition, we have been using a material that's derived from your own blood called platelet-rich plasma. Platelet-rich plasma is basically using the components of your blood that is required for healing, called platelets, as well as the plasma, which is rich in growth factors that we have learned to use in a way to stimulate the quality of the skin. You see, when there is a genetic dark circle under the eyes, if there is any benefit to improving the circulation and the collagen, then platelet-rich plasma is a very good treatment. What we have done, in addition, is combined platelet-rich plasma with hyaluronic acid and have seen a very nice synergistic benefit. It appears, based on also wound healing literature that's been established, that the combination of platelet-rich plasma with hyaluronic acid results in this wonderful volume enhancement that's a combination of many things that actually is more long-term. And so, although these procedures the response to these procedures, I should say, vary from patient to patient. There is a lot of benefit when we get this more long-term benefit because we're using your own platelet-rich plasma to stimulate collagen and blood supply, which is a healing response. And so we have seen long-term benefit that I feel at this point is superior to using a filler alone. And that's a very important distinction. Much of this field of doing this type of work requires both the treatment and the observation of the response, and no two patients respond the same way. But I think that in your situation, it is worthwhile exploring platelet-rich plasma, hyaluronic acid filler, and the combination as a strategy to help you improve the dark circles under your eyes. Meet with qualified, experienced cosmetic surgeons who perform these procedures, and hopefully you will get a result that you're happy with. So I thank you for your question. I wish you the best of luck, and thank you again for your question.